for the patience and understanding you have shown as the province proof of vaccination system is rolled out. We ask that everyone continue to demonstrate the same cooperation and understanding that has gotten us this far, and to focus on what these temporary measures mean to us. They mean we can allow businesses the comfort to keep operating safely. They mean we can continue getting back to doing things we want without losing the gains we've made. And they mean we have the best chance to avoid being forced back into lockdowns that nobody wants. Much like the vaccine rollout, we asked Ontarians to pull together, and you've responded once again. And for that, I thank all of you. Starting today, individuals born in January, February, March, and April can log on to Ontario's vaccine portal to download their enhanced certificate, which now includes their official QR code. Tomorrow, individuals born in the months of May to August can do so, followed by anyone born in the months of September to December on October 17th. We cohorted the downloads to help ensure a smooth and seamless experience, while ensuring that everyone can be ready well before the new enhanced certificate takes effect on October 22nd. As of 6 a.m. on October 18th, any individual, regardless of your birth date, will be able to log on and download. Also, as of today, businesses and organizations can download and verify Ontario app to scan and verify customers' QR codes. This will give businesses an opportunity to test and get used to the app, well ahead of October 22nd implementation of the enhanced certificate. Together, the enhanced certificate and Verify Ontario app will make it easier and more secure for Ontarians to show their proof of vaccine. As we've developed these tools, protecting your privacy has been top of mind. Minister Elliott and Rashid will go into more details, but I want to thank everyone involved in standing these up in a record time, and thank you to everyone. They play a very significant role in our continued fight with COVID-19, and we continue to do well in this battle. We're doing well because our approach was cautious and built on the advice of our public health experts. We've seen what happens in other provinces that move too quickly, and the result can be devastating. Here in Ontario, hospitalizations and ICU admissions remain stable as our daily case counts have declined, even weeks after we began in-class learning. Because of this success, because so many of you have rolled up your sleeves, we're now able to finalize our plans to exit Step 3 of the roadmap to reopen and cautiously lift more public health measures. The work began months ago, and we're finalizing the plan now, including where and when we may need to reapply measures should they be required to stop a surge in transmission. The Chief Medical Officer of Health has been clear. The objective is to avoid further lockdowns. And if additional measures are necessary, they will be localized, tailored, and aimed at limiting disruption to businesses and families. Because this is not just a plan for the short term, but for the long term as well. It's a plan that will stand the test of time. We want to give Ontarians more certainty and a better idea what to expect in months ahead, including updated travel guidance as we approach the holidays. As we do, we will remain vigilant in our fight against COVID-19. We will continue to do what's necessary to protect our communities and our hospitals. Over the past several days, both here in Ontario and elsewhere across Canada, the issue of how to best protect our hospitals has once again come up. As we've seen Quebec delay the implementation of their vaccine mandate for hospital workers, with BC softening theirs. Here in Ontario, many hospitals have implemented mandatory vaccine policies, as our government has maintained flexibility for health leaders to do so if appropriate. While some have called for province-wide mandate, any decision to do so needs to be weighed against the real risk of staff shortages that could compromise care. According to recent estimates, 15% of our health system workforce remains unvaccinated, putting the magnitude of potential staff losses in the tens of thousands. Let me be clear, every hospital worker should be vaccinated, and we encourage all of them to get vaccinated, and the vast majority have. But at a time when our doctors and nurses are already stretched to their limits, especially in northern and rural areas, we can't afford to lose qualified staff. At the same time, outbreaks in hospitals remain a rare occurrence. Thanks to the comprehensive infection prevention and control measures, in the past 2 weeks, there's been 2 outbreaks in hospitals involving a handful of cases. That's good news, and we can call a welcome news. But all told, this is a very complex issue with real risks on either side, risks that need to be weighed against the unintended consequences they may force. Recognizing the complexity of this issue, I've asked our top experts in the province for their feedback. This is an issue we need to get right, and we will, because together there's no challenge we can't overcome. Thank you, and God bless the people of Ontario. I'll hand it over to Minister Elliott.